So, hello, good afternoon, everyone. Please, if you are hearing me, can you please say hi in the comment section? This is time for introduction to toxicology. If you are hearing me, just say hi in this comment section. Okay, I want to believe that they are going to join very, very soon. Okay. Today we are because of our time, we will not. I won't waste time because of our time. We have to uh, go straight to the business of today, and that is talking about introduction to toxicology. Ever before, whenever we come across the word toxicology, so we might be saying different things. So today is going to be a beginner's guide. That means for some of us that are just coming up in environmental biology. Okay. The first thing we are going to look at, what do we mean by toxicology? This is scientific study of harmful effects of substances on living organisms. So anytime we want to look at how harmful a substance could be, for example, even if it is water, if we want to know how harmful it should be, it is the study of toxicology, that is study of toxin. So what we mean by toxicology sometimes can be regarded as the scientific study of poison. So scientific study of poison and its effects, that is another thing. So that means if you are talking about anything harmful, that means it is poisonous. So the scientific study of it and the effect of it is what is regarded as a toxicology. And this in this lecture, we are going to touch on the principles of toxicology. We are going to look briefly at the history of toxicology, then what are the branches of toxicology, then the scope within the operational scope of toxicology, and lastly, we will look at the classes of toxicology. Okay, toxicology, this is the study of adverse effect of chemicals, which could be physical or it could also be biological agents or on living organism and its environment as and its ecosystem. Example of toxin, the study of toxicology is just if you want to study the effect of pesticide on farmers' health after you must have applied uh, pesticide. So we are trying to look at the overall effect on the sprayer, that is, or somebody that is making use of that pesticide. It is often regarded as a uh, toxicology. Okay, so what are the key terms in toxicology? Number one, toxin. Toxin means these are poisonous substances which can be produced naturally. Toxin from biological agents. It could be in form of from plants, it could be from animals. Then sometimes it can also be from microorganisms. So it's not only plants and animal only, but it is also in microorganism, that is in the prokaryotic organism. So then whenever we come across the word toxicants, toxicants are man-made substances that when it is introduced, it is going to cause harm. It's going to be harmful. These are toxicants. And whenever we are regarding, we come across the word dose. Dose means the quantity of substance received. For example, a cup of water. Now, there's a water, no matter how harmless it could be, it has the tolerable dosage that it can that human can take per time, per unit time, so that it will not cause any effect. So that is a dose. Then LD, that is a leather dose to 50% of a test organism. So that is the dosage or the dose that is able to kill 50% of that organism. For example, if you are administering a chemical substance like mercury on 200 animals. And that 200 animals, uh, the LD dosage for 50 means 50% of 200, that is 100. Okay. So example is when you example of a toxin are snake venom or pesticide exposure. So if you are trying to assess how poisonous a snake venom could be and the effect of being exposed to pesticide, that is some of these toxin and toxicants. Okay. Principle of toxicology. The principle of toxicology is inherent in four basic principles. That is number one, you have to study the dose response relationship, what we call the DRR. DRR is very, very important. The dose response relationship. Then exposure routes is very, very important. Oral, that is when you swallow oral, is it inhalation? Will it be dermal? So exposure route is very, very important. It will determine if that poison, if that substance is going to be regarded as a toxin or not. So the exposure route is very, very important. Then the duration of exposure. Is the duration of exposure, is it going to be short term? Is it going to be long term? So that is it going to be acute or is it going to be chronic? That is also very, very important in toxicology. The another one is individual susceptibility. That's telling you that the amount of a point that the tolerable amount of any substance in Mr. A will be quite different from what Mr. B can tolerate. That is individual susceptibility, which can be as a result of different factors. It could be as a result of environmental factors. It could be genetical factors. It could be a lot of things, or nutrition can also affect the susceptibility of an individual. Okay. An example is alcohol tolerance, which differs among individuals. There are some people that if they take just a cup of alcohol, that is they will, is going to affect them. They It's going to affect them, and whereas some can even take 10 10 cartons a day and it won't. So that is what we are talking about when we look at individual susceptibility. Okay. And issue of toxicology, just like I said, that in the early part of this presentation, that we are going to look at a brief history of toxicology. In 1493 to 1551, there was a man called Paracelsus. So he is being regarded up to today as the father of toxicology. He was the one that came up with the mantra that the dose make the poison. So that is, dose is very, very important whenever we talk about how poisonous a substance could be. And the issue of toxicology can also be traced back to the early days of Socrates, when he talked about hemlock poisoning in 399 before Christ. Then development of forensic toxicology actually started in 19th century, and this can be traced back to Napoleon's death, which was possibly linked to arsenic poisoning. So these are part of what then forensic toxicology, the branches of toxicology. Forensic toxicology, that is investigating poisoning and drug use. So anytime you want to conduct analysis into the poisoning of any substance, or it could be drug as well. That is, you are studying forensic toxicology. Then we also have clinical toxicology, that is treating poison patients. So you apply clinical. Environmental toxicology, studying of the effects on ecosystem. Regulatory toxicology, that is setting safety limits of different substances on that. Example is lead in paints and children's health. So if you are studying that, you are practicing any one of the that is clinical toxicology. That is the effect of lead in on children's health. So okay, um, human health risk assessment, drug development and scope of toxicology. Scope of toxicology, that is whenever you are trying to assess human health risk assessment. Then drug development and safety, occupational health and safety, and environmental protection. So this can be traced back to Bhopal gas tragedy. So there was a tragedy that occurred in 1984 in India in particular, where some people just saw that there was a kind of smoke all around. So all of them just came up. There are some of them that by the time they inhaled it, some of them got unconscious immediately, and there were some of them that developed the effects later on. Okay, so what are the classes of toxic agents? So all these toxic agents or toxin can be divided into three: chemical agents like pesticides, metals like mercury, and solvents. There are some solvents like benzene and so on. Then biological agents. So we also have a toxic agent like which are biological in sources. So bacteria, viruses, and toxin also include, not only limited to this, toxin. Don't forget that I said toxin will be from plant and animal. So these are part of what we join to in biological agent. Then the physical agents like radiation, air heat, noise, all these are physical agents. Okay, an example of classes of toxic agents include mercury poisoning in Minamata Bay in Japan. So route of exposure, I told us that the route of exposure of toxin or toxic chemical is very, very important. Number one, inhalation. Okay, the route of exposure can be as a result of inhalation. It could be injection, that is when you swallow it. It could be dermal exposure, that is through the skin, and it could be also as a result of injection. And then a case study of this is asbestos workers which inhale fibers, which eventually can lead to their lung cancer. Okay, factors that affect toxicity. I've told you that according to Paracelsus, that the dose make the poison. So dose is number one. Then the duration of exposure, the duration of the time of exposure is very, very important. The age and sex is also very, very important. Under normal circumstance, adults have more tolerable, I mean, more tolerance than the elderly one, as well as children, because we believe that this one, they have diminished ability to be able to fight against some of these agents. And sex, either male or female. Then genetic factors is also another important, and the health status of that person will actually determine how that poison is going to uh, how it's going to perform. Okay, example: children are more sensitive to lead exposure, so adults can tolerate it more than children. So that is an example where age and sex will also come in. Then acute versus chronic toxicity. Acute means short term. Acute, short term, high dose, e.g., cyanide poisoning. So chronic, that is a long term exposure. That when you talk of acute, that means the effect is going to be instant. It's going to be felt instantly within a very short period of time. You will see the effect, just like the case of the Indian exposure. That is which I said some people saw it and then immediately they started developing sicknesses. Some of them collapsed, some of them fell into coma. All these are part of all this is an example of acute toxicity. Okay, then chronic, that is long term, like smoking, asbestos. All the effect are long term. It could be 1, 2, 3 generations before the effect will be felt. This is an example of a chronic toxicity. So an example is that of smoking. Case, that is the case study of chronic alcohol use and liver damage. So there are some people that whenever they say smokers are liable to die young, so it doesn't actually mean some people can be 120 years, 150 years, and they won't feel the effect at all. So because the alcohol effect is a chronic effect. So the relationship between alcohol use and liver damage is a long-term effect. It's not going to happen immediately. It's not going to happen within a short period of time, but it's going to take place in a very long period of time. It can take years, it can take even hundreds of years before the effect will be felt. So then I also mentioned those response relationship. So the higher the dose, the greater the effects. So you should know that should be established in you that those response relationship, the higher the dose, the greater the effect. Okay. Example is that small doses of caffeine stimulates very high small doses of caffeine, so will just stimulate, you just feel dizzy, or you just feel loss of momentary loss of momentary loss of memory. So but whenever you consume it in a very high dosage, you just discover that it's going to cause toxicity, is going to be immediate. Okay, so then in this course we will also talk about toxicokinetics as well as toxicodynamics. So what do we mean by toxicokinetics? Kinetics, kinetics, that is movement. Toxico from toxin, so that is the movement of toxicants in the body from the point at which it is inhaled to the last point in which it is excreted. So that's why toxicokinetics is talking about absorption, distribution, how it is the toxin is going to be metabolized, and how at what point is it going to be excreted. So example is alcohol, which is metabolized in the liver. um it is when it gets to the liver, when alcohol gets into the liver will now metabolize it into acetaldehyde. So it's not going to be form the same form you absorb it. It's not going to be the same way or the same form it is going to be metabolized. So or it's going to be secreted. So what we will rather say is that toxicokinetics is the study of the movements of toxicants from the points of entry to the point of exit. So that is you are trying to measure the journey. The journey is like when you want to travel from here to Lagos, uh, measuring your kinetics will start from the point you are taking off to the point at which you will be getting down from the vehicle. So the same way, the toxicokinetics is going to be talking about the journey of toxin in human, okay, in the body. Then toxicodynamics. Dynamics this time around, dynamics, it means that dynamism, interaction, is going to involve interaction. So that is how toxicants interact with the biological targets. So it could be in form of a receptor, and every toxin or every poison must have their biological target. There are some that will only target the liver. There are some that they will only target the kidney. There are some that will target the skin. There are some that will target the eye. There are some. So in the way it will interact with their target, biological target, is what is called toxicodynamics from dynamism. Dynamism means what? That is an interaction. You'll be able to interact. It could be in form of a receptor binding. Maybe it's going to bind, it's going to be in form of a lock and key. Or is it going to be enzyme inhibition? Is it going to prevent some enzyme from being secreted? Or is it going to damage the skin? I mean, sorry, the DNA. So an example, the case study of this is a carbon monoxide which bind with hemoglobin, thereby preventing oxygen transport. So toxicodynamics is like you are trying to study the mechanism, the way they work, the way they interact, the way they interact. All poison must have their targets. All poison must have their biological targets. So you need to know that. Then a case study is a case of lead poisoning. So as a result of and where did they get this lead poisoning? From paints. Our paints contain lead, pipes and battery. So all batteries contain lead. So the effect is usually cognitive impairment. That is, it affects the performance of the brain. Sometimes it can lead to shortage of blood, and this is children are the most vulnerable. So, and we have example of that in Flint and Michigan water crisis. We can actually read more about all these case studies, the flames, or the lead poisoning in flames, as well as lead poisoning in Michigan water crisis. Okay, case study, that is a pesticide exposure. So that is you see, pesticides are made up of organophosphates, which inhibit acetylcholine esterase. This acetylcholine esterase is an enzyme that is found in the central nervous system. So whenever you inhale pesticide, the targets of pesticide will be this enzyme. So, and the symptoms is that the person will convulse. It could be an adult, it could be. So what I'm trying to say is just that it's a case study, pesticide exposure. So an example in farmer is farm workers which are exposed to pesticide. If care is not taken, uh, the don't forget that the more the dosage, the more the effect, toxicological effect. Okay. Then another case study is the Chernobyl disaster of 1986. So the sources of radiation from nuclear accident and medical imaging, for example, all this X-ray, all this one can actually lead to cancer and often lead to genetic mutation. And we have seen example of that. Then occupational toxicology. There are some people, especially factory workers as well as miners, they are continually being exposed to poison, to some poison at their place of work, and that's why they normally pay them heavily for occupational hazard. So that is what they normally advise is use of safety gear and regulation. So the case is asbestos miners and those in mesothelioma. Okay. Environmental toxicology. So it's like you want to start measuring the impact of toxin on soil, water, air. So, and we will have to talk about bioaccumulation and biomagnification. So the effects in the soil could such be that the soil will tend to be accumulating it for a long period of time. And there are some times that even the environment will even try and magnify the effect. The the dose could be very, very minimal, but when it gets to the environment can as well, depending on how safe the environment is, the content of that environment. If the environment is already overstretched, you just discover that the effect is going to be bio-magnified instead of it to be bio-accumulated. So, and whenever it is bio-accumulated, we just discover that, for example, in water, if water bio-accumulates it and human being, all the um, eh, organisms, all lives in water, all aquatic life in water, anybody that consume that will definitely, okay, for example, the DDT that is affecting bird reproduction, that is a typical example of that. Then forensic toxicology, that's play a very significant role in criminal investigation. So, for example, identifying drugs and poison in the bodies. So if somebody is died of unknown cause or suspected to die of consumption of poison, any poison, so we can actually employ the services of a forensic expert or forensic toxicology to be able to do that. And a case, detection of cyanide in Tylenol mothers of 1982. There was also one I told us about in earlier video, I think sometimes in first semester. Then clinical toxicology, that is diagnosis and treatment of poison. So, and the use of antidotes. If somebody takes accidentally swallow a poison now, there are when you take them to the hospital, just discover that they will just give you an antidote, and that is clinical. So regulatory toxicology, establishing exposure limits, that is what are the tolerable limits of every poison or every substance, every chemical or every pesticide. So all these will have their own tolerable effect. Evaluating safety of chemicals and drugs. So if all the chemicals around you, don't forget that we live with poison every day. We have poison around us. If water can be regarded as a poison depending on the dosage, so you will know that we have 99% of what we live with at home. Too much of salt, problem. If you consume salt, it will bioaccumulate for a long period of time, and it is known to be hazardous. And all these are part of a regulatory toxicology, that is, we want to study the acceptable limits, okay? And the case study of Bhopal gas tragedy, I told us in 1984 in India. So they discovered that methyl isocyanate gas leaked and thousands of lives were lost. So, and apart from the instant, that is, apart from the chronic effect, they still discovered that it also had, apart from the acute effect, it also had long-term effect, that is the chronic health effect on some people, apart from the thousand that died instantly. Okay, this demonstrates the importance of industrial toxicology. So there are some of us that we live very close to industries that can be hazardous to our health. So all these are part an example of what you. Then a case study of Minamata disease in 1950 in Japan. There was a mercury pollution from a factory, and what happened? It led to neurological disorder in the whole community. So this is an example of environmental and food chain toxicology. So once the mercury leak out, so some people got unconscious. So some people lost their sanity. So that is a case study. Then we also have another branch of toxicology, which is called ecotoxicology, which is the study of toxic effect on ecosystems. Toxic effect on ecosystem. So which could be aquatic or terrestrial. An example is the oil spillage or oil spills, which affect marine life. Okay, Then principles of biomagnification. I told us that concentration of toxicant increases up the food chain. So the concentration, you remember our food chain. So DDT in fish, the fish will be birds we feed on the fish. So then the source will now the fish will now be the source. The bird will take up the fish, will take up the bird. Okay, sorry. Example is DDT in fish. The fish will swallow DDT or will bio magnify or bioaccumulate the fish. Then when fish is now eaten up by birds, is now being consumed by birds. So the bird will now also bioaccumulate it for human being that is going to later consume the bird, and you can see that the concentration of toxicants will increase up the food chain. So and that is what we call biomagnification. Then risk assessment in form of hazard identification, dose response assessment if you are practicing that, exposure assessment and risk characterization. Example is evaluating the risk of pesticide in our food. So that is a risk assessment. Then risk management. Policies and regulations are in place in order to minimize the harm. Then thereby we have to monitor compliance into all these regulations, and we should be able to enforce the regulation. So, for example, you can see that in some countries they have banned leaded gasoline, gasoline. You see, some of the petroleum, some of the fuel we consume in Nigeria are leaded. So, and that means it can also cause poison to us, to the environment. Okay, but in some countries this has been banned long time ago. For example, I remember that in United States of America, DDT has been banned since 1970s. Okay, and the summary of what we have done is that you should know that toxicology is the study of harmful effect of agents. Then the principle, dose response, relationship and exposure route are very important. The branches of toxicology are forensic, clinical, environmental, as well as regulatory. Case studies, we have real world relevance or real world examples that I have mentioned in this course. Toxicology is central to public health, not only that, to the environment and also to the industry. So the question now is that how can the society balance chemical with their safety? I want you to do this as well. You do this and submit normally. So you have the following multiple choice question. Number one, which of the following statement is true about toxicology? Is it that toxicology only studying natural toxin, or did those make the poison, or that all chemicals are toxic at any dose, or that toxicology excludes environmental effects? That is, how can you define what can you say generally about toxicology? Okay, then which of the following is an example of chronic toxicity? You remember chronic versus acute. Chronic is long term, acute is short term. So cyanide poisoning, snake bites, smoking related lung cancer, and food poisoning from bacteria. Which of them is going to be chronic? That is, which of these four options is going to be long-term toxicity? Then the essay question, which I also want you to do, attempt as well, which I'll be expecting you to submit it in the comment section. You have to discuss the importance of dose response relationship in toxicology. Then after that, you provide examples of how small doses and how doses of the same substance can have different effects on the human body. That is, you have to look at give us example of, for example, if you pick up lead now, so you have to give us example of lead which is consumed in small quantity, and the same lead which is also consumed in large quantity as well. So you have to discuss the effect on human body. So thank you for your listening attention. So take care.